Hello everyone, I'm Robin and I am a business analyst, and about the project that I'm working on right now is about a healthcare streamlining application, Careconnect, and the requirements I received are from my business owner, Selena. And before going into details about this project, here is the agenda that I am going through today. To analyzing this problem, we'll go through the problem statement, access process, and persona, and then we come up with some solutions before selecting the final one with the key features to be processed, wireframe, assumptions, and constraints. Okay, let's get started. The first one is about a problem statement. According to the report by the Australian Institute of Health and Welfare, Australia will welcome about 600,000 international students each year, and these students face the unique challenge of how to navigate. They don't know exactly how to navigate the Australian healthcare system because the healthcare system in Australia is quite different from other countries, and the proof of this is long wait time in the hospital. If you're taking a look at this graph, which is about the waiting time statistics for emergency department at the hospital in different categories from 2022 to 2023, and I won't go details about the non-urgent cases. Only 88% of non-urgent cases is seeking being sick, being received the medical attention on time. Seen on time here mean that they receive the medical attention within the specified time, and for the non-urgent cases, the specified time is 120 minutes. What do you think about this number? It's not a short time, isn't it? And the causes of this long waiting time is offline registration. The patient have to wait in the line to receive the paper registration forms. And for the patient who does not speak English, the language barrier could make this process slow and cumbersome. And the others challenges is about the verification of insurance and the ID. The verification process will be done manually, so it time consuming. And the other challenges is the waiting time spending on allocating doctor. So the purpose of this project is to alleviate the challenges faced by not only the international students but also the other patients, by in assessing the healthcare system in public hospitals by developing an application that optimize the process of filling all the forms, book appointments, and also make payments. The impact of this project is to reduce wait times. This is our priority. By allowing patients to complete all of the necessary form in advance and so book appointments, that would reduce the time spending on waiting in the hospital, and it will improve the patient experience. And the other impact is streamline the administrative processes. The app will integrate automatically all of the form submission, like ID verification, insurance verification. It will reduce the administrative burdens on hospital staff, and it will enhance the data accuracy by reduce the errors that can occur with handwritten forms and manual data entry. The other impacts are the better resource allocation for hospital staff, increase accessibility for patients, improve the communication between the patients and the hospitals, and have a good impact on environment. Okay, let's go to the access process. As I mentioned before, I won't go detail about the emergency cases. This project will be more focused on the non-urgent situation. So when you have the health concern, you need to find the nearby hospital and go to the hospital to see the receptionist here before seeing the doctor, of course. And the receptionist will request you to fill all of the information, like the registration with basic information about you. the insurance detail forms, and they will verify your information manually by contacting the insurance providers, and it take really long time to verify it. So what happened if the insurance information you provide is not correct? You have to refill the form, and when everything is correct, the patient will be created the portfolio at the hospital database, and then you have to wait again until you see the next notice about the examination form, and the doctor you will see. Okay, and then you follow the notice to receive the doctor and receive the diagnosis services. Okay, about the persona. Okay, this is Riki Nishimura. He is a Japanese international student, 19 years old, and recently he has been facing the persistent headaches and noticeable weight loss. And about his health concerns, he decided to seek attention at the hospital, but he don't know exactly how to navigate this healthcare system. And about his habit, he frequently uses mobile apps for various daily tasks like communication and learning. He prefers digital communication. No, he prefers digital solution for convenience and efficiency. What makes him feel struggle is about the understanding and navigating the Australian healthcare system. He thinks it's quite difficult to communicate effectively due to the language barriers, and he also experienced frustration of long waiting time at hospital, just for filling the repetitive form. And his needs are to quick access to the medical services, clear instruction and guidance to use the healthcare system, and ability to fill out all necessary form and book appointment in advance to avoid long waiting time at hospital. And his goals are to receive timely medical attention for his health concerns, have a seamless and efficient healthcare experience without the language barrier. And what makes him happy is he can fill all the necessary form in advance and also book appointments, and so he doesn't have to wait a long time at the hospital. He has a clear guidance and instructions throughout the healthcare process and enhance the convenience and efficiency in managing his health record. Okay, so after discussion, we come up with some solution. The first one is about orientation programs, which are designed to educate the international student about the Australian healthcare system, including the informative sessions, a regular workshop, and resource distribution. However, it's quite time consuming, and it could lead to the situation of information overload because there's too many information to observe at once. So come out with the second solution about email newsletters, which are sent directly to the students about the information of Australian medical system, the role of GPs, and how to access the medical services in Australia. However, this one could lead to the email overload when the student receives a lot of emails and they just overlook and ignore it. The third one is about the health app. The health app is designed to provide information about Australian healthcare system, including recommending the nearby GP and how to seek emergency department as well as pharmacy in Australia, but it will require a high development and maintenance costs. And actually, from hospital perspective, we don't think that the three solutions are good for the hospital revenue. So we came up with a final solution of pre-admission app. This app can streamline the hospital admission process by enabling the patients to complete all of the essential forms in advance, upload the relevant documents and book appointments. And this app can be convenient for both patient and hospital. For patient, because the patient can fill all the forms in advance, so it will reduce the times waiting at the hospital. And for the hospital, it will, besides streamlining the administrative processes, It will increase the accuracy of data by reducing the errors associated with the manual data entry and the handwritten form. Here are the key features we want to focus on this app. The first one about the digital form completion, when the user can fill all the forms, which is about the personal detail, the medical history, the ID, and insurance information, and they can fill it in their language. The second feature is appointment booking, where the user can schedule appointments and receive the notification or reminders for upcoming appointments. The third one is about the document verification. The document verification here, I mean the ID and insurance information. The app will allow the user to upload the ID and update their insurance information, and the app will help them verify them in advance, so they don't have to do it in the hospital. So the fourth feature is a payment process. The user can choose their suitable method from multiple options, and they will receive the notification about billings. And the final one is about a QR code check-in. It will simulate the check-in processes by just scanning the code. So we'll go to the to-be process. Because the to-be process is quite complicated, so I divided it into 3 small processes here. The first one is about the registration and booking appointments. About registrations, it would be quite similar to the other app, when the app requires the basic information to create an account with Careconnect, and the patient or the user will be able to fill the medical history form and the insurance information form on the app. And the app will help them to verify this information with the insurance provider. If it's not matching with the insurance provider system, the app will ask the patient to refill the insurance information. And when everything is correct, the patient's information will be saved into the patient database, and the app will send user the financial responsibility form, and the user needs to review and sign the form. And the user will be able to schedule appointment on the app, and to secure your appointment, you need to pay in advance, but I won't go detail about the payment process later. The second process is about the patient visit. The assumption I made here is the patient already has an account with Careconnect and already fill all the forms. And when they come to the hospital and see the receptionist, the staff can scan the code, and all of the information will be integrated automatically into the hospital database. And if there's anything incomplete, the patient will need to refill the forms again. And when everything is correct, the patient needs to present the staff with their ID. And after verification of the ID, the app will update the instruction, and you just need to follow the instruction to receive the diagnostic services in the hospital. Let's go to the making payment. To make payment on the app, you will receive the payment notification on the app, and you will be able to review your bills. You can select the payment method that is suitable for you and input your information here. The app will verify your payment information with the payment service provider. When everything is correct, you will be able to make payment successfully on the app, and the app will generate the receipt for you. Okay, here's the ERD, but I won't go detail about it. And about the functional and non-functional requirements, I think it's better if we go to the wireframe to see it clearly. Here is the wireframe that I created for Careconnect. We can get started by logging into this account with the email mobile. So if you don't have an account with Careconnect. You can sign up with the basic information, create a password, and log in into the Careconnect. Here is the home screen look like. On the home screen, you will be able to see the bookings, which is about your upcoming appointments and the recent activities you have with the app and the support and help when you can seek for assistance. If you click here, you can see the QR code. This is unique generated for each patient. And when the staff at hospital scan this code, they will reconfirm your appointment, and the system will integrate it automatically your information with the database system. And you can click here to receive the instruction to receive the service in hospital. And about, okay, let's go to the profile. In the profile, you're able to edit your profile, update document hub, receive, review billing and payments here, change the password, review our privacy policy, setting about notifications and the language, seeking for help, and about the document. Here is the information that you can update. And when you update your profile, you can verify your ID with Careconnect by select a document type and upload your document here. Okay, so when everything is verified, you can change the other document here, any other. Like, let's go to the document hub. In the document hub, you can fill all the form of the medical history and insurance. About the medical history, you need to fill this form about your illness, your surgeries, your allergies, and the current medications. You can edit it if there's anything is not correct here and submit it with the system. About the insurance, we provide the option of input your Medicare detail for Australian citizens. Here's about the private insurance. When everything is correct, they will verify your insurance with the insurance provider and then send you the financial responsibility. In this responsibility form, you will know exactly which services will be covered in your insurance and which needs to be paid out of pocket. You have to review it and agree with it. Yes, and here, go back to the home screen to here. Here's the booking functions. In the booking function, you can book an appointment with different services. Here is the example of the service list. If you click on the services, you can choose the date and time which is available for you. And in this session, you can describe briefly about your problem here and then book appointment with us. To secure your appointment, you need to make a payment. We provide patients with multiple payment methods here. You can choose which one is suitable for you, and when you choose it, you can make a payment on the app. If when your appointment is booked successfully, you will be able to add it to your calendar, and it will come up with just your notification here. You could quite similar with that, and you can see all of the appointments here with different category. The complete one, the upcoming one, and the cancel. For upcoming one, you can cancel your appointment by just clicking on the the X symbol. And now the app may ask you to fill the reason why you can cancel your appointment and add the review, but it's all optional. And here's the cancel appointment. Yeah. So after you finish receiving the medical services as hospital, when your health records is updated, you will able to view your health records here. Or if any additional services you have to pay, here is the bill, and you can make a payment with us. Yes, so that pretty much about a wireframe. When developing this app, we have to make many assumptions, but I will focus on the most important one. The first one is about the technology, that we assume that the user have to access your smartphone with the internet connection, and the app will be available on both iOS and Android platforms. And the second one is about the healthcare system integration. The app can integrate with the existing electronic health record system in the hospital, and the hospital will have a necessary infrastructure to scan the QR codes as well as access patient data in real time. And the other one is about the verification. The app will collaborate with relevant authorities and as well as the insurance providers to verify this information for the user. And the biggest constraint we might face is the limited integration with a third-party system. The third parties here, I mean the insurance providers and the relevant authorities. The app may have limited inconsistent integration with different insurance providers, affecting the accuracy and timeless insurance verification. So, to define the success of this project, we believe that our priority is the form fillings optimization and the reduction in the waiting time at hospital. And our target is to achieve about the 75 to 87% reduction in waiting time at the hospital for the non-urgent cases. That means the waiting time would be reduced from 120 minutes to just 15 to 30 minutes. So that's all about my presentation today about the healthcare streamlining application Careconnect. So if you have any question, feel free to ask. Thank you for your listening.